Have you ever wondered why some people struggle to focus, act impulsively, or seem overly active? Could it be ADHD, and how does it impact women differently? Attention deficit/hyperactivity disorder, more commonly known as ADHD, is a neurodevelopmental condition that affects both children and adults. It is characterized by persistent patterns of inattention, impulsivity, or hyperactivity that interfere with functioning or development. ADHD is often associated with children, particularly boys, but it's essential to understand that it affects people of all ages and genders. Although symptoms often start in childhood, they can continue into adulthood, impacting individuals' personal, academic, and professional lives. Let's debunk a common misconception. ADHD is not just a disorder for children or males. Women and girls struggle with ADHD too, but their symptoms might present differently, leading to underdiagnosis or misdiagnosis. ADHD in women often goes unnoticed because it manifests less as hyperactivity and more as inattentiveness. Women with ADHD might be labeled as forgetful, disorganized, or emotional, rather than being identified as having a neurodevelopmental disorder. This misconception can leave many women struggling in silence, misunderstood, and undiagnosed. The primary characteristics of ADHD include difficulty maintaining focus, hyperactivity, and impulsivity. However, these symptoms can vary greatly from person to person. Some may struggle more with inattention, having difficulty organizing tasks, following instructions, or maintaining focus on one task. Others may exhibit more signs of hyperactivity and impulsivity, such as restlessness, excessive talking, or acting without thinking. Understanding these characteristics is crucial, not just for recognizing ADHD in oneself or others, but also for challenging the stigma and misconceptions surrounding this condition. ADHD is not a reflection of a person's intelligence or abilities, and it certainly isn't due to laziness or a lack of discipline. It's a complex disorder with a broad spectrum of symptoms and impacts. Now that we understand what ADHD is, let's delve into how it uniquely affects women. So, how does ADHD present differently in women compared to men? When we think about ADHD, we often picture a hyperactive boy who can't sit still. But this stereotype can be misleading. ADHD is not just a male disorder, and it doesn't always involve visible hyperactivity. Women with ADHD tend to exhibit less overt symptoms, which can lead to underdiagnosis and misdiagnosis. Women are more likely to have inattentive ADHD, which doesn't have the hallmark signs of hyperactivity and impulsivity. Instead, they may struggle with organization, focus, and following through on tasks. They might be labeled as forgetful or lazy, when in reality they're grappling with a neurodevelopmental disorder. Societal and cultural factors also play a significant role in the underdiagnosis of ADHD in women. Society often expects women to be organized, meticulous, and nurturing. When a woman struggles with these skills due to ADHD, it can be wrongly attributed to character flaws or a lack of effort. Moreover, ADHD in women often presents alongside internalized symptoms like low self-esteem, chronic stress, and a persistent sense of underachievement. These symptoms can mask the underlying disorder, leading to women being overlooked or misdiagnosed with conditions like depression or anxiety. The challenges faced by women with ADHD are compounded by hormonal changes that occur during puberty and menopause. These hormonal fluctuations can exacerbate ADHD symptoms, making it even more difficult for women to manage their condition. Moreover, women with ADHD are more likely to have comorbid conditions such as eating disorders and substance abuse. This further complicates their diagnosis and treatment, as these conditions can overshadow their ADHD symptoms. Recognizing these unique symptoms and challenges is crucial for the accurate diagnosis and effective treatment of ADHD in women. Acknowledging the impact of societal expectations and understanding the influence of hormonal changes can help us better support women with ADHD. It's clear that societal factors and unique symptoms contribute to the under-recognition of ADHD in women. But what other factors are at play? Did you know that ADHD doesn't typically exist in isolation, especially in women? Quite commonly, women with ADHD may also grapple with other mental health conditions. These coexisting conditions can sometimes mask the symptoms of ADHD, leading to underdiagnosis and delayed treatment. Anxiety and depression are two such conditions often seen alongside ADHD. The constant struggle to manage ADHD symptoms can lead to feelings of anxiety and, over time, depression. In addition, many women with ADHD may struggle with eating disorders. The impulsivity and lack of self-regulation associated with ADHD can lead to binge eating or bulimia. Substance abuse is another common comorbidity. Some women may turn to alcohol or drugs as a way to self-medicate, to cope with the challenges of ADHD, or to help manage coexisting conditions. Understanding these coexisting conditions is crucial in providing comprehensive care for women with ADHD. By acknowledging and addressing these conditions, we can ensure that these women receive the holistic support they need to thrive. Knowing the challenges, what are the effective treatments for women with ADHD? This question brings us to the heart of our discussion. It is important to remember that treatment for ADHD isn't a one-size-fits-all approach. It needs to be tailored to each individual's unique needs and circumstances. The first line of treatment often involves psychoeducation. This is a fancy term for learning about ADHD. Understanding the disorder's ins and outs can be empowering. It helps women with ADHD make informed decisions about their health, understand their symptoms, and learn strategies to manage them. Next, we have cognitive behavioral therapy, or CBT. This form of therapy helps individuals identify and change thought and behavior patterns that lead to problematic behaviors. For women with ADHD, CBT can assist in developing coping strategies to manage symptoms, such as inattention or impulsivity, and can also help address issues of self-esteem, which are often impacted by ADHD. Pharmacotherapy, or medication, is another treatment option. Stimulant medications like amphetamines and methylphenidate are the most commonly prescribed for ADHD. These medications work by increasing the levels of certain chemicals in the brain that help with focus and attention. Non-stimulant medications are also available and may be used when stimulants are not effective or cause undesirable side effects. But treatment doesn't stop at medication. It also includes lifestyle changes, like regular exercise, a healthy diet, adequate sleep, and mindfulness practices. These can all play a significant role in managing ADHD symptoms. It's also crucial to remember that women with ADHD may have coexisting conditions like anxiety, depression, eating disorders, or substance abuse. These conditions need to be addressed as part of a comprehensive treatment plan. In conclusion, the treatment of ADHD in women requires a multifaceted approach that includes psychoeducation, cognitive behavioral therapy, pharmacotherapy, and lifestyle modifications. Each woman's treatment plan should be individualized to her unique needs, symptoms, and coexisting conditions. With these treatment options, managing ADHD becomes achievable. But what about during special phases like pregnancy? Pregnancy can be challenging, but how does ADHD factor into this equation? Attention deficit/hyperactivity disorder, or ADHD, can pose unique challenges during pregnancy and motherhood. This is not only due to the symptoms of ADHD itself, but also the changes in hormonal balance that take place during pregnancy, which can exacerbate these symptoms. Women with ADHD may find it harder to keep track of prenatal appointments, maintain a healthy diet, or remember to take prenatal vitamins regularly. The hormonal surges that come with pregnancy can heighten ADHD symptoms such as forgetfulness, impulsivity, and difficulty focusing. This may lead to increased feelings of stress and overwhelm, which could have implications for both mother and baby. Furthermore, the postpartum period can bring additional challenges for women with ADHD. The demands of a newborn, coupled with lack of sleep, can further intensify ADHD symptoms. This can make the transition to motherhood even more challenging, potentially leading to feelings of inadequacy or failure. However, it's important to remember that having ADHD does not preclude the possibility of a healthy pregnancy or successful parenting. With the right support and treatment strategies, mothers with ADHD can effectively navigate these challenges. Management of ADHD symptoms during pregnancy often involves a combination of medication, therapy, and lifestyle changes. It's crucial to consult with a healthcare provider to discuss the potential risks and benefits of continuing ADHD medication during pregnancy. Cognitive behavioral therapy can be beneficial in helping to manage ADHD symptoms and develop coping strategies. Regular exercise, a healthy diet, and adequate sleep can also play a significant role in managing symptoms. Parenting with ADHD may require additional strategies. This might include creating structured routines, using reminders or alarms for important tasks, and seeking support from others, such as family, friends, or support groups. Though challenging, with the right support and treatment, mothers with ADHD can effectively navigate pregnancy and parenting. To recap, we've delved into the world of ADHD in women, a topic that needs more awareness and understanding. We began by defining ADHD, unraveling its primary characteristics, which include inattention, hyperactivity, and impulsivity. We then explored the unique manifestation of these symptoms in women, highlighting the societal and cultural factors that often lead to its underdiagnosis. We proceeded to discuss coexisting conditions common in women with ADHD, such as anxiety, depression, eating disorders, and substance abuse. We emphasized the importance of recognizing these conditions for a comprehensive approach to treatment. Speaking of treatments, we outlined evidence-based options, including psychoeducation, cognitive behavioral therapy, and pharmacotherapy. We also addressed the unique challenges faced by women with ADHD during different stages of life, specifically during puberty, menopause, pregnancy, and motherhood. Remember, understanding is the first step towards acceptance and effective management. Let's continue to educate ourselves and others about ADHD in women.